Depression. Depressive, often known as severe depression disorder or clinical depression, is a difficult condition to overcome. It is a disease that affects the soul and body, as well as the way people think and behave, and it can lead to a variety of emotional and physical problems. It is one of the most common diseases in the world, and people who suffer from depression often find it difficult to go about their daily lives, as depression causes a lack of desire to live. Although depression is not restricted to a single age, gender, race, or group, data show that more women than men have been diagnosed with cancer. This is due to women seeking treatment more frequently than men. Depression symptoms. Because depression manifests itself differently in different persons, symptoms of depression may manifest differently in a 25-year-old than in a 70-year-old. Furthermore, some persons with depression may experience symptoms that are so severe that they plainly signal that something is wrong, while others may simply feel bad or unhappy without knowing why. Depressive symptoms include the following: a loss of interest in routine everyday activities. Nervousness and despair are common. A sense of helplessness. Sudden bouts of crying for no apparent reason. Sleep disruptions. Concentration problems. Decision-making difficulties. Weight gain or loss that is unintentional. Anxious. Worry and boredom. Extreme sensitivity. A sense of exhaustion or weakness. A sense of inadequacy. Loss of sexual desire. Suicidal ideation or attempted suicide. Physical issues that are not explained, such as back or head discomfort. Depression causes and risk factors. Although the specific etiology of depression is unknown, various physiological, genetic, and environmental factors, like with other mental diseases, can play a role, including 1. Biochemical elements. The use of imaging with modern and advanced techniques has revealed that physical changes have occurred in the brains of people suffering from depression. It is unclear what these changes are or how significant they are, but elucidating this matter would eventually aid in identifying and determining the causes of depression. It is possible that neurotransmitters, which are naturally occurring substances in the human brain, are linked to mood and play a role in depression, and that a hormonal imbalance in the body is the cause of depression. 2. Genetic influences. Depression is more common in those who have depressed biological ancestors, and researchers are currently looking for genes that cause depression. 3. External influences. To some extent, the environment contributes to the development of depression. Environmental variables are occurrences and conditions in life that are tough to confront and live with, such as the death of a loved one, financial difficulties, and extreme stress. 4. Other factors. Although the specific etiology of depression is unknown, some factors tend to raise the chance of depression developing or worsening, including suicides among family members, mourning depressive mood, cancer, heart disease, Alzheimer's disease, and AIDS. Long-term usage of some medications, such as blood pressure meds, sleeping pills, and contraceptive pills in some situations. Depression complications. Depression is a challenging disease that can place a significant strain on individuals and families, and untreated depression can lead to disability, dependence, and even suicide, as well as severe emotional, behavioral, physical, judicial, and economic problems. It has an impact on every aspect of life. Risks of depression include suicide, substance abuse, narcotic drug addiction, anxiety, cardiovascular disease and other illnesses, workplace or educational issues, interactions within the family, problems in the marital connection, isolation from others, depression diagnosis. During routine therapy visits, doctors and therapists ask about mood and thoughts. Patients are sometimes asked to complete a questionnaire to assist them detect depressive symptoms. Doctors conduct a battery of medical and psychological examinations when they suspect a patient is depressed. These tests serve to rule out other diseases that could be causing symptoms, as well as identify and uncover potential complications associated with the condition. 1. Depression diagnostic tests. The following are some of the tests. A physical examination is required. Laboratory examinations. A psychological assessment. 2. Depression diagnostic criteria. An evaluation by a doctor or psychiatrist can assist identify whether the problem is severe depression or one of the other disorders that might mimic severe depression, such as judgment disorder is a mental condition that affects emotions, ideas, and behavior. It is caused by an extreme emotional reaction to a traumatic incident in one's life. Manic depressive psychosis was the previous name for bipolar disorder. Mood swings from one extreme to the other characterize this sort of disease. Adjustment disorder. Cyclic mood disorder is a form of adjustment disorder. Partial depression is an illness that is less severe and challenging than depression, but it is more chronic. Postpartum depression. This is a type of depression that affects certain women after they give birth to a child, and it usually begins about a month after the birth. Psychotic depression is a type of severe depression marked by psychotic symptoms and phenomena such as hallucinations. Schizoaffective disorder, SAD. This illness combines the symptoms of schizophrenia and mood disorders. Winter depression. This type of depression is linked to seasonal changes and insufficient sunlight exposure. Depression treatment. In certain circumstances, depression is so severe that the doctor or someone close to the patient must closely monitor and follow up on the patient's treatment until he improves and is able to participate actively in decision-making. 1. Depression management. The majority of health professionals treat depression as a chronic disease that requires long-term treatment, similar to diabetes or high blood pressure, because while some people with depression only have one episode of depression, the symptoms of depression recur and last a lifetime in the majority of patients. Even though the symptoms of depression are severe, proper diagnosis and therapy might help to alleviate them. People with depression can feel better in a few weeks with proper therapy, allowing them to resume their normal lives as they were before they were depressed. A family doctor may be able to aid with depression treatment, but in other circumstances, a skilled psychologist, such as a psychiatrist, psychologist, or social worker, is required. It is critical for the patient to participate actively in the treatment of depression. The doctor or therapist can decide with the patient what sort of depression treatment is best and most appropriate for the patient's situation through collaboration and joint work. 2. Treatment options for depression. Include the following information. Medications. Because there are dozens of drugs available to treat depression, depression symptoms can be reduced by combining medication and psychotherapy. Although most antidepressants are similarly effective, some of them can have very serious and dangerous adverse effects. The following are the stages of depression treatment. 1. Antidepressant drugs known as selective serotonin reuptake inhibitors are often the first line of treatment for depression, SSRIs. 2. A class of antidepressants called as tricyclic antidepressants is a common second option. The third common option is a class of antidepressants called as monoamine oxidase inhibitors. All antidepressants have the potential to generate undesired side effects, which manifest in variable degrees of severity in different patients. These adverse effects are sometimes so minor that they do not need stopping the medicine, and they may go away or diminish within a few weeks of starting. Begin therapy. Psychotherapy. Talk therapy, counseling, and psychosocial therapy are all terms used to describe psychotherapy. Psychotherapy is sometimes used in conjunction with and in parallel with pharmacological therapy. Psychotherapy is a broad term for talking with a therapist about your circumstances and related concerns in order to treat depression. Chromatography. A current of electricity is sent across the brain, causing a deluge of emotions. 3. Overcoming depression. Depression can sometimes be so severe that the patient must be admitted to the hospital for treatment in the psychiatric department. However, even in severe cases of depression, deciding on the best method of treatment and whether it is the appropriate treatment, or whether the patient can be treated outside the hospital, is not always easy. The doctor is unlikely to recommend hospitalization unless it is equally or more effective. In circumstances where the patient is unable to care for himself or when there is a real worry that he will damage himself or others, hospitalization in a mental facility is usually preferable. Depression prevention. Although there is no method to avoid depression, there are several things that may be done to reduce or eliminate repeated symptoms, such as: take steps to reduce stress in order to increase happiness and self-esteem. Friendship and family support, especially during times of difficulty, can help you overcome depression. Treating the problem as soon as the first indications or symptoms occur can help prevent depression from getting worse. Long-term depression prevention also avoids recurrence of symptoms. Alternative medicine. Some people utilize complementary or alternative medicine methods to reduce depression symptoms, such as the use of herbs or alternative therapy methods. However, before using these methods, you should visit a doctor to check if they conflict with the standard treatment methods, which include St. John's wort, Hypericum perforatum, fatty acids omega-3. Acupuncture is a type of acupuncture. Yoga, meditation, massage treatment.